Scientists reveal the number one fruit to eat before bed for better night vision. Most people accept it quietly. The gradual blurring, the way headlights smear across your windshield at night, the way you squint at your phone first thing in the morning, hoping your eyes will finally cooperate. You tell yourself it's age. Everyone tells you it's age, and so you adjust. You sit closer to the television. You stop driving after dark. You smile and nod when the doctor hands you a stronger prescription and move on. But what if that explanation is only half the story? The American Academy of Ophthalmology has been very clear in its recent literature. After the age of 60, the eyes undergo a series of accelerating biological changes that go far beyond simple refractive error. Macular degeneration, cataracts, glaucomatous pressure changes, severe dry eye syndrome all become dramatically more common. And the National Eye Institute has confirmed what many researchers feared. Vision loss among older adults is rising faster than at any previously recorded point in modern medical history. Here is what makes this particularly dangerous, and what almost nobody explains clearly. The most significant damage to your eyes is not happening while you are awake. It is happening at night. While you sleep, your retina, that thin and extraordinarily delicate layer of light-sensitive tissue lining the back of your eye, is supposed to be undergoing its most intensive cycle of cellular repair. Photoreceptor cells, the rods and cones responsible for your ability to see in both bright and dim conditions, require a constant supply of oxygen, antioxidants, and specific molecular nutrients during this overnight window. When that supply is insufficient, damage accumulates silently, the cells degrade, the tissue thins, and most people do not realize what has been lost until the impairment is already measurable, and in some cases, irreversible. I hear one question more than any other in my practice. Why is my vision getting worse even when I am doing everything right? And is there anything I can actually do about it that does not involve medications with difficult side effects or surgical procedures I am honestly afraid of? Here is the truth. Most conventional interventions, prescription drops, corrective lenses, even laser surgery, are designed to manage symptoms. They are not built to address the underlying biological processes driving the deterioration in the first place. A study published in JAMA Ophthalmology confirmed what researchers had been observing for years. Age-related retinal damage consistently begins with two primary processes: oxidative stress accumulating in photoreceptor cells and chronic low-grade microinflammation in the vascular structures supplying the retina. Both processes are most aggressive at night during the precise window when your eye should be doing its deepest repair work. But here is the part that genuinely changes the conversation. Recent peer-reviewed research has identified specific natural compounds found in certain everyday fruits that have demonstrated a meaningful capacity to intervene in both of these destructive processes. These compounds can cross the blood-retinal barrier, a critical and highly selective membrane that most dietary antioxidants never penetrate. They can support the regeneration of damaged photoreceptor cells, reduce microinflammation in retinal vasculature, and improve overnight circulation to the macula, the central zone of your retina responsible for sharp, detailed vision. My name is Dr. Michael Turner, and I have spent 2 decades working with aging adults who are committed to protecting their visual function using approaches grounded in evidence. Today, I am going to walk you through 7 specific fruits that research suggests can actively support overnight eye repair, along with the timing, preparation, and pairing strategies that determine whether these nutrients actually reach the tissue that needs them. Everything I share here is educational and is not a substitute for professional medical evaluation. If you are experiencing vision changes, please see a licensed eye care professional before altering your diet or supplementation. Your vision is not something to experiment with carelessly. Now let us get into it. Number 7, kiwi. Small, slightly fuzzy, and easy to overlook in the produce section. But for the aging retina, kiwi delivers something remarkable. As oxidative stress accumulates in the retina over the decades, the protective systems that worked efficiently in your 40s begin to fall behind. Colors mute, Contrast flattens. Night driving becomes something you quietly dread. Kiwi is exceptionally rich in lutein and zeaxanthin, the two carotenoids that eye researchers consistently identify as foundational to retinal protection. These compounds function as biological light filters within the retinal layers, absorbing high-energy blue light and providing continuous antioxidant coverage during the overnight repair cycle. Kiwi also contains serotonin precursors that support deeper, more restorative sleep stages. And deep sleep is not incidental to eye health. It is when intraocular pressure drops, cellular debris clears, and photoreceptors replenish their light-sensitive pigments. How to use it. Eat 2 golden kiwis, not the green variety, approximately 60 minutes before bed. Golden kiwis carry more lutein and cause less digestive discomfort late at night. When eating, scoop the flesh with a spoon rather than peeling to the edge. The thin layer immediately beneath the skin contains concentrated caffeic acid, a potent antioxidant. Leave that inner rim intact, and you keep more of what makes kiwi worth eating. Number 6, watermelon. If you regularly wake up with blurry vision that takes an hour or more to clear, poor overnight retinal circulation is very likely involved. Watermelon is over 90% water, which supports tear film quality, but the more compelling mechanism is lycopene, a carotenoid antioxidant found in high concentrations in the red flesh. Observational studies have consistently linked higher lycopene intake with reduced oxidative damage in retinal tissue and lower incidence of both cataracts and macular degeneration. Compounds in watermelon also support nitric oxide production in vascular endothelial cells. Nitric oxide relaxes and dilates blood vessels, including the extraordinarily fine capillaries supplying your retina. Better dilation means improved oxygen and nutrient delivery overnight, exactly when photoreceptor repair is most active. How to use it. 1 to 2 cups of chilled seedless watermelon about 30 minutes before bed. Avoid adding salt. Elevated sodium intake is directly associated with increased intraocular pressure, a significant risk factor for vision loss. And do not discard the white rind. That pale inner section contains citrulline, an amino acid that supports healthy vascular function and retinal microcirculation. Blend it into a smoothie or lightly pickle it if the flavor alone does not appeal to you. Number 5, black currants. Tiny, deep purple, and genuinely difficult to find in most North American grocery stores. But for targeted retinal protection, specifically night vision and optic nerve health, black currants have some of the most compelling clinical evidence on this entire list. They contain extraordinary concentrations of anthocyanins, the pigment compounds responsible for their deep color. In the eye, anthocyanins reduce pro-inflammatory activity in retinal vasculature, support dilation of vessels supplying the optic nerve, and facilitate regeneration of rhodopsin, the visual pigment stored in rod photoreceptors that governs your ability to see and adapt in low light conditions. A randomized placebo-controlled trial involving glaucoma patients found that 50 milligrams of black currant anthocyanins daily over 24 months produced significant improvements in optic nerve blood flow and meaningful deceleration of visual field loss compared to placebo. A separate study found improvements in dark adaptation speed, the rate at which your eyes shift from bright to dim environments. For older adults who struggle with nighttime driving or moving between differently lit rooms, this is directly applicable. How to use them. Fresh black currants are hard to source. Look for a standardized extract at 50 milligrams per dose, taken in the evening alongside a small amount of healthy fat and a vitamin C source, such as a slice of orange. The fat improves bioavailability, while vitamin C supports anthocyanin stability during digestion. Number 4, blueberries. Here is something that will surprise you. The way most people eat blueberries cancels out a substantial portion of their benefit before the nutrients ever reach the retina. The key active compound is pterostilbene, a stilbenoid antioxidant related to resveratrol, but with significantly greater bioavailability and a demonstrated ability to cross the blood-retinal barrier and act directly on oxidative DNA damage in photoreceptor cells. A 2023 study in nutritional neuroscience found that older adults who consumed wild blueberries daily for 12 weeks showed statistically significant improvements in visual acuity and meaningfully reduced eye strain during digital screen use in low ambient light. The critical detail: the large, pale, cultivated blueberries in most produce sections carry measurably lower concentrations of active compounds than wild blueberries. Wild varieties, typically found frozen, contain nearly double the protective antioxidant density, and frozen is not inferior. The freeze-thaw cycle ruptures cell walls and actually increases bioavailability of the compounds your eyes need. How to use them: 1/3 of a cup of wild blueberries 45 minutes before bed. Never combine with dairy. The proteins in milk bind directly to anthocyanins in the digestive tract, physically blocking absorption. Eat them alone or paired with a small amount of healthy fat. Number 3, dragon fruit. Visually dramatic and increasingly available in mainstream stores, but the variety matters completely. White-fleshed dragon fruit does not contain what we are looking for. You need the deep red-fleshed variety, and the reason is a class of compounds called betalains. The problem dragon fruit specifically addresses is retinal hypoxia during sleep. When your retinal tissue does not receive adequate oxygen overnight, the repair cycle is incomplete. You sleep 8 full hours and wake up with eyes that feel heavy and slow. Colors look flatter than they should, and over time, cumulative oxygen deficit compounds in ways that become clinically visible. Red dragon fruit is among the richest dietary sources of betalains, nitrogen-containing antioxidants that support nitric oxide synthesis in the fine capillaries and arterioles supplying the retina. A 2022 study in Frontiers in Aging Biology found that participants who consumed red dragon fruit extract for 6 weeks showed significant improvements in ocular microcirculation, contrast sensitivity, and visual field depth. In practical terms, they reported clearer vision in low light and reduced blurry vision on waking. How to use it: half a red-fleshed dragon fruit about 60 minutes before bed. Chew the black seeds rather than swallowing them whole. Those seeds contain omega-3 fatty acids and magnesium, both of which support retinal nerve health overnight. Swallowed intact, they pass through largely unextracted. Number 2, goji berries. Bright red, mildly sweet, and used in traditional Chinese medicine for more than 2,000 years, with eye health cited explicitly as a primary application. The clinical evidence is now beginning to establish the mechanisms behind what practitioners observed empirically for centuries. Goji berries target macular thinning directly. The macula is the central region of your retina, responsible for the sharp, detailed vision you use for reading, recognizing faces, and navigating daily life. As we age, oxidative stress and declining microcirculation degrade macular tissue progressively. This is the foundational pathological process of age-related macular degeneration, the leading cause of irreversible central vision loss in adults over 60 worldwide. Gram for gram, dried goji berries are among the highest natural dietary sources of zeaxanthin available. While lutein distributes broadly across the retina, zeaxanthin concentrates specifically in the macular zone, the area most vulnerable to age-related degradation. A 2021 study in Nutrients followed adults aged 60 to 80 who consumed dried goji berries 5 days per week for 90 days. Results showed a statistically significant increase in macular pigment optical density, a validated clinical measure of macular protection, and no participant showed progression of macular degeneration during the trial period. How to use them: soak 2 tablespoons of dried goji berries in warm water for 10 minutes before eating, which improves digestibility. Consume them about 30 minutes before bed. Pair with a small piece of dark chocolate containing at least 85% cacao. Flavonoids in high cacao chocolate have been shown to enhance bioavailability of zeaxanthin. Together, these two foods deliver more protective compound to your macula than either would independently. And now, number one, the fruit that tops this entire list. It is not exotic. It is not expensive. You may have one on your counter right now. It is papaya. Papaya targets what may be the single most overlooked and most destructive process behind blurry vision, cloudy lenses, and early cataract formation in older adults. That process is glycation. Glycation occurs when excess blood glucose bonds chemically to proteins in your eye tissue. When glucose attaches to the crystalline proteins forming your lens, it creates advanced glycation end products that progressively cloud the lens and degrade retinal vascular architecture. This is a continuous silent process operating in virtually everyone over 60, and it is happening most aggressively in the very tissue you depend on most. Papaya contains papain, a proteolytic enzyme with documented anti-inflammatory and protein-modifying properties that research suggests can interfere with the glycation cascade at the molecular level. Beyond papain, papaya delivers a comprehensive combination of beta-carotene, vitamins C and E, and folate, a profile that acts synergistically to reduce oxidative stress in both the lens and the retina. A 2023 study in clinical gerontology followed older adults who consumed fresh papaya in the evening over 6 weeks. Follow-up analysis showed significantly lower circulating levels of advanced glycation end product markers alongside measurable improvements in tear production and contrast vision scores. For seniors dealing with dry eyes, blurry morning vision, or early lens clouding, those outcomes are worth taking seriously. How to use it. 1 cup of ripe papaya cubes approximately 60 minutes before bed. Fresh papaya is far more effective than processed varieties, where heat treatment destroys enzyme activity. Allow your papaya to reach room temperature before eating. Remove it from the refrigerator at least 30 to 60 minutes in advance. Cold suppresses papain activity, and you want this enzyme fully functional when it reaches your digestive system. Do not combine with dairy. And do squeeze fresh lime juice over your papaya before eating. The vitamin C in lime meaningfully enhances your body's absorption of beta-carotene from papaya. Your retina gets more of what it needs, and the flavor is genuinely excellent. Before we close, 5 rules that determine whether any of this actually works. Ignore them, and you could eat every fruit on this list and still leave significant benefit behind. Rule 1. Avoid high-calcium foods within 90 minutes of your evening fruit. Dairy and calcium-fortified foods can reduce absorption of lutein and zeaxanthin by up to 30%. Treat your evening fruit as a standalone snack, not part of a larger meal. Rule 2. Always add a small amount of healthy fat. Lutein, zeaxanthin, lycopene, and beta-carotene are all fat-soluble. Without fat present during digestion, your body cannot fully absorb them. A few walnuts, a teaspoon of flaxseed oil, or a few slices of avocado can increase absorption of fat-soluble eye nutrients by more than 50%. Same food, dramatically better delivery. Rule 3. Wash gently and wash right before eating. Aggressive scrubbing strips surface antioxidants from berries where protective compounds are concentrated near the skin. Rinse under cool water, pat dry, and do not wash hours in advance. Rule 4. Serve at room temperature. Refrigeration suppresses enzyme activity in papaya and several other fruits on this list. Allow 30 to 60 minutes of warming time after removing from the refrigerator. It is the difference between consuming an enzymatically active food and one whose most important functional properties have been temporarily disabled. Rule 5. Eat your evening fruit 60 to 90 minutes before sleep. Too early, and the nutrients are cleared from circulation before your eyes enter their primary repair window. Too late, and active digestion disrupts the slow-wave sleep during which retinal repair is most intensive. The window is specific. Hit it consistently, and you give these compounds their best opportunity to perform. Blurry vision is not a verdict. It is not an irreversible consequence of living long enough. In a significant number of cases, it is the result of specific, addressable biological processes unfolding in retinal tissue. and growing evidence suggests that certain whole foods consumed at the right time and prepared correctly can meaningfully support your eye's natural capacity for overnight repair. Think about what that means in practical terms. Reading without straining, driving at night without that quiet anxiety that has been building for years, waking up and seeing clearly within moments of opening your eyes, looking at the people you love, and seeing every detail that makes them irreplaceable. That is what this is really about. Not just vision, independence, confidence, the freedom to engage fully with your own life. I want to hear from you now. If your vision improved noticeably tomorrow morning, what is the first thing you would want to see clearly again? Leave your answer in the comments. I read everyone personally, and I genuinely mean that. If this was useful, please like this video and subscribe for more evidence-informed content on protecting your vision and your health as you age. And if someone you care about is over 60 and quietly struggling with their eyesight, share this with them. You may be giving them something genuinely important. This is Dr. Michael Turner. Take care of your eyes. There is no replacing them.